And I said to her, you got to get better images. And we worked on the images and got them better. And for the next couple of months, her case acceptance was genuinely above 90%. Above 90% of cases that needed treatment that we were presenting at the time, over 90% was getting accepted. Hey everybody, it's another episode of Your 5 Minute Friday. I'm Dr. Glenn Krieger here. And I want to talk to you about something super important for case acceptance. Now, as you know, this is a month where Tracy Martin is going to be speaking at Orthopreneurs University. It is a course you and your TC do not want to miss. She is one of the masters of teaching treatment coordinators how to get better case acceptance. But as you've heard me talk about in other episodes of the Orthopreneurs podcast, you've heard me mention that if you think that case acceptance begins when the case is presented or when you walk in the room, you are sadly mistaken. We all know, if you look at the research on when people buy, they buy when the first phone call is answered. They buy when they see your website. It's not when you walk in the room. The case is probably 90% done by then, and you can only just not screw it up, which is why I tell you, get out of the room if you're the doctor. Don't stay there. But there is something you can do to help your treatment coordinator get better case acceptance, to help your team get more confidence in the patient, and it's simple. It's called digital co-diagnosis. Now, I've done numerous podcasts. You may have taken my Orthopreneurs University course on clinical photography. If you haven't, it's helped thousands of doctors over the years. My techniques have helped thousands understand how to get better case acceptance through better photography. And if you take my clinical photography course and digital co-diagnosis at Orthopreneurs University, for sure it will help you. And you just go to orthopreneurs.com and click on Orthopreneurs University. But great images will tell a story in a way that you cannot. And if your TC has exceptional images in the room for patients to look at, the job is almost completely done. Because there's a big difference between me showing a photo of somebody and telling them, hey, by the way, your bite is off, you need orthodontics. There's a big difference between that and me showing them an exceptional image and asking them, hey, by the way, do you see how these teeth hit? Right? And by the way, in clinical photography in the Orthopreneurs University course, I show you a picture you should have on your wall that you can take to show them an ideal bite. And then I show them the image that I just took on them and say, what looks different between these two teeth? And I guide them. And that's digital co-diagnosis. It's a form of motivational interviewing. So it's much better to say, hey, when you look at this picture versus your picture, the picture of the ideal bite, what looks different to you? Do you notice anything different about the way the teeth come together? Do you notice the way these teeth come together like a set of gears? Now yours do they look more like gears or more like rocks hitting against rocks? Now, that's just one of the things I talk about. But you're not telling them their bite is off. They're going to say, oh, they look like rocks hitting against rocks. Exactly. Which seems like a healthier, smoother, less traumatic way for teeth to hit. Smooth like a set of scissors or gears or rocks on rocks. And of course, the answer is always rocks on rocks. And now you're starting the conversation. And that's known as digital co-diagnosis. And it will make all the difference in the way you present care to your patients. Now, Tracy Martin and her course that she's giving on how to get better case acceptance by better communication and better systems is going to help augment that. Because I just told you that case acceptance doesn't start when they're in the room with you. It starts when the phone is picked up and questions are asked. And the TC is given information for a specific TC call or for an insurance call. But every generation does things differently. Boomers are different than Gen Z. And you have to know how to deal with them separately. And that's what Tracy's going to go through. But if you don't know about digital co-diagnosis, that is truly like the cherry on top of the sundae, putting gas on the fire, so to speak. Doing what Tracy tells you is going to help you immeasurably, and adding digital co-diagnosis to that will give you slam dunk. And to give you a quick update, I had a TC in my practice who was new, wonderful young lady, great, smart, charismatic, really hard worker. And she didn't get very good case acceptance for the first 4 to 6 months after she started. And then one day I gave her a little bit of advice and I said to her, you got to get better images. And we worked on the images and got them better. And for the next couple of months, her case acceptance was genuinely above 90%. Above 90% of cases that needed treatment that we were presenting at the time, over 90% was getting accepted. We used the techniques that Tracy Martin and others have taught us, and we use digital co-diagnosis. So start by taking the course of Tracy Martin. She's amazing. You'll love her. She's going to walk you from A to T. I call it T because point A is when they start. Point T is when the treatment coordinator gets involved. She's going to teach you A to T on all the things you need to do, particularly in the younger generation. And then later on, take digital co-diagnosis And you should know my TC takes her own images. She had no experience in dentistry. I walk in the room and the images are already uploaded and the patient's pretty much ready to start treatment. I'm just coming in to say hi and introduce myself. And that's the way it should be. So go sign up for the course. Go to orthopreneurs.com. Go to Orthopreneurs University. Look for the course for Tracy Martin. Sign up. Look at the one for digital co-diagnosis. Sign up for that one or for clinical photography. I promise, if it doesn't change your practice, you message me and I'll make sure you get every penny back. But nobody ever does because these are great courses. I hope what I'm giving you here in terms of case acceptance tidbits are helping you. I know for sure that what Tracy will give you will help you immensely. And always know that I'm here to help in any way I can. Just reach out to me, all right? Wishing you a great day and can't wait to see you at the course.